Welcome mtazamaji wetu hapa kwenye Nuru ya Asubuhi. It's a beautiful Thursday, a morning that God has given to us and has just blessed us with, that we get to enjoy this day. We get to enjoy His goodness, His mercies, you know, His blessings throughout this day. I hope you're getting to enjoy that. Today is Family and Health Thursday, and our focus of today is on matters breast cancer. And as we were mentioning, as we were beginning this month, we said that this month actually is dedicated for that. So we want to understand more about breast cancer. And so if you have any questions concerning it, feel free to join in the conversation via the SMS line on your screen, and also via our Facebook page and YouTube page, that is Mizpah TV Kenya. In studio, we have Dr. Winnie Othiambo, who is going to help us understand more about breast cancer. She is from Optimum Hospital, and she will be here to help us understand more. So karibu sana ili tuweze kusemezana. Good morning, Dr. Winnie.
Good morning.
How are you doing?
I'm well, thank
Ni
you.
kama tulisoma memo. Black.
Yeah, absolutely, absolutely.
Welcome to Mizpah TV.
Thank you so much.
So, breast cancer. I'll start with this kwa sababu nimesikia kafununu. Can men get breast cancer?
Absolutely, yes.
How? Like, we know it's women, we know that. So what is happening? Why? How?
So anybody with breast tissue can get cancer, definitely.
So men have breast tissues?
Yes. You've seen maybe you are washing up a child or any person with a bare chest have nipples. So they definitely have breast tissues, and they can actually get breast cancer. And I've seen men get breast cancer quite often.
Okay, allow me to ask this question in itaka awkward. So when they get breast cancer, for women we've seen that they amputate. Amputate. What is it done? Katwa. Let me use that.
Mastectomy.
Yes.
Yes.
So is it done to them as well?
So there's different ways of doing the surgery. We have the mastectomy, we have lumpectomy. That means that we are just removing the lump that is there. So yes, they can actually have one of the lobes, because the breast tissue is quite wide. The anatomy of the breast tissue is different. So whatever place is affected can actually be removed. Is it be it just the lump itself that we are removing, or we are removing the tissues itself?
Okay.
So yes, it can be removed.
Yeah,
and there are different options of treatment that I know we are going to talk about them.
Nice.
Yeah.
Now that takes us now to what is actually breast cancer, because now we've seen that both men and women, hakuna kusema hiyo ni historia ya wanawake. Pia wanaume sikizeni, listen, this is also for you. So what is breast cancer?
So breast cancer is wide, but cancer itself, well, let me just define the name cancer.
Yeah.
So cancer is just abnormal cells that grow in a specific place abnormally. They can be very aggressive in growth. So for breast cancer, it's just abnormal cells growing in the breast tissues.
Okay.
Yes. And they are malignant. Malignant means that they are destructive. So at the end of the day, they actually are very destructive and can cause various types of issues in your body. Yes, if not handled appropriately.
Okay. And so what causes that, abnormality of those the tissues growing in that place? So
we currently don't know what causes breast cancer, but we have like risk factors.
Okay.
By risk factors, we mean that there's some factors that can actually put you at a risk of getting breast cancer. So one of them is the family history. Maybe your aunties, your cousins, or your familial history has a history of breast cancer. So that can actually expose you to breast cancer. There are other issues like the race. There's maybe Africans or Caucasians being more prone to breast cancer.
Yes.
It's just we really don't know.
Oh,
but
was it that like Mbona African? Okay, but we are prone to that.
Yeah, we are prone to getting breast cancer. And then of course age. Women above 45 years and above are more likely to also get breast cancer. But we've seen even younger girls in their 20s getting breast cancer. So it's not really that they have to get it, but it predisposes them more highly to breast cancer. We also have a history of smoking. the smoking has a bit of nicotine that actually, or some substances that can actually expose you to breast cancer as well. Yes.
Okay.
So there's a lot of factors that can predispose you to breast cancer, but no specifically things that if you do this will actually make you get breast cancer. It's just predisposing factors.
Okay.
Yeah.
But I'm sure we'll talk about it. But in the later on, as we'll be getting to wind up, we'll talk about some of the things that are there things we can do to prevent ourselves from getting, the breast cancer and all of that. I'm sure we are going to be discussing in depth about it. Now we've known the risk factors that get to affect these people. Now I've gone and I've come to you, Dr. Winnie, and I've told you, kuna vile. It seems I've just come for the normal screening. The normal. How many times are we supposed to do the screening? How many times should we go for the general checkup?
So if you're below 40 years, at least once a year.
Once a year.
Yeah, if you're above 45 years, at least bimanually. That means even twice a year.
Okay.
Yes.
So I've come for the screening. So what should I be feeling, that can tell me, hata kama nilienda screening last month, I need kuna kitu. So what are some of the signs of breast cancer, so that a person can know from an early stage rather than waiting for the stages, the fourth stage and all that?
Okay. So there's no specific sign that will tell you that now I have breast cancer. But there are specific things that can guide you. One of them is just feeling a lump on your breast. A lump is just like a small swelling on your breast. Of course, there are other things that we look at that can still have your breast swelling. There are a lot of other issues, medical issues, that can still make you feel like that. But to be sure, it's to visit a doctor or visit your healthcare provider to just ascertain that. So one of the things is a lump, a feeling in your breast that there's something that is actually swollen in your breast. So for that, you need to go to visit your healthcare provider. Then they'll be able to do a number of tests, do a breast examination, and then ascertain whether you actually have the breast cancer. Apart from that, some things can, the nipple can also be painful, maybe producing some discharges. So it's also important that you visit your healthcare provider. The breast can change shape, and this one we see in very advanced stages, because as the tumor swells and as it eats on your breast tissues, you can find like your breast is a bit, it has a shape fulani too, that you're not very, it's not like a common shape or the normal shape that you know. There's another thing that we call peeled orange. You see the way the orange looks like. Your breast tissue start looking like ikona too small. You know the orange fruit. Yeah, it has a funny color. Then it has too small swellings on the breast.
Okay.
Yeah, and also retracted. By retracted nipple, we mean nipple imeingia huko ndani. Yeah, so your nipple could also be retracted due to breast cancer. But this, we are not saying that is really, if you have a retracted nipple, you have breast cancer. No, the primary way of knowing it is just diagnosing it through hospitals. Visit your healthcare provider, and maybe just speak out what you're feeling in your breast, and then we'll run a number of tests, including mammogram, which we are also going to talk about. And then it's your healthcare provider who will be able to diagnose you. Sometimes we even take tissues to take to the lab so that they can be tested and actually know whether you have breast cancer or not. Okay. Yes.
So there is the early stages, and you said maybe you get in a very early stage, is that you'll get to feel there is a lump, and so sometimes we get to ignore that, because to be honest, okay, allow me to ask it, what should the lump feel like? Because there is the normal. We were taught even in high school how to self-examine yourself, And so what should the lump, because I find so many people asking that, because inafaa kufeel nini actually, inafaa kuwa ngumu, inafaa kuwa soft, as I'm trying to self-examine myself, what should the lump feel like? Because I think that's a question most people are always asking.
Yeah, so normally the breast has like feeling that you feel when you're doing your examination. So I know you were taught, but we can still also take them, our viewers through.
Yes.
So basically, you just divide your breast in 4 quadrants.
Okay.
Just do like a cross.
Yes.
So you have 4 quadrants, the upper 2 and then the lower 2.
Yes.
So as you do your examination, you place your hands in the upper quadrant, just like massage it, and feel any lump. By any lump, anything that is swollen that you can actually feel a bit hard.
Okay.
So you
swollen and hard.
Okay. So you feel the first quadrant, you go like clockwise, move to the lower quadrant, and then move to this other one. Just slowly, you massage it, and you feel anything that you might feel that is not common with your breast. There's that normal breast swelling that we normally feel, but that one is movable. You notice it normally moves around.
Okay.
Yes.
So the one that is non-movable is the issue now.
Yeah, but in case you feel like this is not normal, like I'm feeling there's like a swelling in my breast, but it's not normal, it's very important that you visit your healthcare. If you're not sure, please don't ignore. Just visit your healthcare provider. So you massage it throughout, and then you can also press your nipple and see if there's any discharge that is coming. Of course, not milk if you're breastfeeding. Yeah, but any discharge that is coming out shouldn't give you a red flag. Yeah.
Okay.
Yeah, but if you're not sure, you are not sure about you examining yourself, you can also visit. These days it's more or less free almost every other place. Just walk into any hospital, your healthcare provider will be able to do an examination for you.
Yeah, at least then that one you'll be sure by the time you're leaving, I have left, I am 100% sure.
Absolutely.
Okay. And you said that from the age of 45, that's the age where most women are prone to that. But also you mentioned that you can have people even in their 20s who get to have this issue. And now after what is the next step after I've done my screening and I've been told, you know what, there could be, there is, something, a lump in your breast. What should be done from there?
So there are a lot of ways we can diagnose you with breast cancer. Most importantly, we'll do a mammogram. A mammogram is like an X-ray. I know everybody knows how X-ray works.
Yes.
So for this one, it's an X-ray for your breast. So we're going to put your breast under a certain machine. So it will press on your breast tissues, and then this will be able to focus on where exactly the lump is. So once we see where the lump is, your doctor might take you in for a minor surgery, then get the breast tissue, that exact lump, that wherever place it is. It could be in the ducts, it could be in the lobules. Then they go in with maybe a needle and get that tissue. It's not like a painful process, but we'll just give you some local anesthesia to just make sure that you don't feel any pain. So they go in, get the breast tissues, and then we take to the lab for histology. So histology basically look at the cells and advise whether it's cancerous or it's not cancerous. Yeah, so it can, yes, you could be having a lump, but then we take it to the lab brings back it's not cancerous, it's benign. Yeah, there are other conditions in the breast that can also bring those kind of lumps. Yeah, so once the results come back, now we can discuss on the treatment options.
Okay. And there's also, we've heard of so many instances where we get to have the stages that come with breast cancer. Could you help us understand better when you're told you are in this stage or in that stage, what does it actually mean?
Okay, so we have different stages from 0 to 4. So by the stages, I don't want to go really deep into them with the very big medical jargons, but to just make you understand is that at stage 0, stage 1, it simply means your lump is just located within the breast tissue. It has not moved anywhere.
And can you have several lumps? It has to be just one, maybe on your right breast or your left breast. Can you have multiple, or it's just one?
So it depends. You can have, normally when we check on one breast and you have a lump on one breast, it is always wise that we also check on our other breast. So yes, it can be both, it can only be one breast. But if it is within the same breast tissue, that's between stage 0, stage 1, then it normally moves to your armpit. Then there's some lymph nodes that you call them gae. Is it gae? Yes. Yeah, so it can move to gae. Now, when it moves there, it becomes stage 2. And of course, when it moves to other areas of the body, now those are advanced stages, stage 3, stage 4. Yes.
Yeah. So it's within the breast that is stage 0 to 1.
Yeah.
Ikienda ianze kwenda kwa towards your armpit.
Yes.
That is stage. And how long what's the duration of this? Because you know, you're saying it so casually. Hadi I'm like, are we still talking about breast cancer here? You know? Like, okay, when it comes within the maybe the lump has started growing. You know, how long will it take for it to go up to the next stage, to stage 2 now? Is there duration, a specific time duration?
So I wouldn't say there's a specific time of duration. So many factors come in play.
Okay.
Depends on your genes yourself, depends on the type of the cancer that you're having. There are more aggressive cancers that will move very, very fast.
Oh.
Even within 6 months, it would have spread almost everywhere. There are also very lenient cancers. So for lack of a better term, of very slow moving cancers. So there's a lot of factors that come to play. So you can't say specifically by this time you should have moved from stage what to the next stage. Exactly. There are so many factors that come into play, including dietary, including your lifestyle, so many things.
Okay.
Yeah.
And you say that there are aggressive types of cancers and the non-aggressive. Yani hadi cancer ikona types.
Yes, ikona types mingi sana. Yes.
So when I have breast cancer, there's also a type. This is breast cancer, but there's a type of breast cancer.
Yeah, so it also depends with which area of your breast it's coming from.
Oh.
We have the ducts, so those are called ductal carcinomas. And I mean, there are such big, huge medical jargons that I don't want to mention, but there are different types of cancers, even in the breast, in whatever place in the body. They're very depending on the tissues that they're affecting. Yeah, we classify them very differently.
Okay.
Yeah.
So which is the most aggressive one? Tupe tu at least tukwe tunarenga tunajua one jargon.
Okay.
Which is the most aggressive that, you know, when you get to hear this, you have, when you usikie tu daktari mention akona this type of, you know, cancer, you unajua hapa ni I work hard to make sure I get rid of this.
Yeah, I know ductal carcinomas can be quite aggressive. Yeah, so those are some of the ones that you quite by aggressive I mean they affect the tissues quite so fast. They move so fast.
Oh, moving.
Yeah. So again, I would say it depends on the factors.
Okay.
Yeah, that come into play. I don't want to make people feel fear. You know, even the fear of going for early detection can. I don't want to create that kind of fear.
Yes.
Yes.
Okay.
So all cancers detected early can really have a great effect on your treatment and of course your survival rate.
Okay.
Yeah.
And so by saying detected early, earliest, you definitely it's between what time to what time, and up to when can we say? Because let's be honest, there are stages 4 that daktari tu atakwambia hapa hakuna hopes, you know, but up to what age can you say like here there's a survival chance for that individual?
Okay, so any cancers that are being detected when it is within the breast tissues, as I say, stage 1, those ones can easily be controlled, because what we need to do is either depending on what area, surface area it's affecting, your surgeon then will be able to either remove the breast or then we just remove that kind of lump. Yeah, so that is an early detection when it is just within, because you can imagine one that is in the armpits or that has spread everywhere, it might not be easy to control. Yeah, so if it's detected when it is within the breast tissue, normally it's easy to control, and there are a lot of treatment therapies that we give, or treatment options. We can use both combined surgery and radiation.
I think we can talk about that after we take a break.
Absolutely.
Ndio watu wasikue Emily, information ni nyingi. Let's take a break so that when we come back we can talk more about some of the things that you can do to make sure at least hata nimesikia kuna diet hapo, so at least tujue which foods you know, can really help to reduce the risk factor, you know, of getting breast cancer. So remember, this week, the whole of this month, we're getting to have that. So make sure either you're a woman or you are a man. Tulisema pia wanaume, woi msijitoe kwa hii nini, msijitoe kwa hii situation. It can also affect you. So let's take a break, but when we come back, we continue with Nuru ya Asubuhi.